Yeah, well, it's been remarkable to watch what's happened to the healthcare system particularly in the last 5 years. I think my wife, we live in Ontario, I think my wife has been without a physician for 4 years, and my physician is moving, and I have no idea how I'm going to replace him fundamentally. I mean, I have options, obviously, and options that most people don't have, but it's very, very interesting to me to watch what's happening to the healthcare system, because it's been a real pride point for Canadians, and even more specifically for the left, the success of Canada's socialized Medicare system. And it's not an easy problem to solve, partly because even the concept of healthcare in some ways is ridiculous. It's much too comprehensive to be considered as something that's a unit. But we have free healthcare in Canada. It's not free because we pay taxes, but it's also not free in another very fundamental way, which is that dying waiting is not free. Wondering, having, for example, when my daughter needed an ankle replacement when she was 16, the waiting list was 3 years. And she was essentially walking around at that point on 2 broken legs. It's like 3 years, eh? That's not 3 years, that's death. Because there's no way you walk around on 2 broken legs for 3 years and make it through that. That doesn't happen to people. And so the waiting list approach to cost is not effective. And so in Canada now we're in a situation where you can't get the care you need often. You can't even get on a waiting list to see a specialist that would provide that care. And you can't have private insurance to cover you, and you can't pay for it. Yeah. So the rationing system in Canada for healthcare is you get to die waiting. Yeah. Right, that's not free.
Well, in British Columbia, we don't actually collect these stats because government likes to operate in secret, which is a whole different topic. But looking at the national stats, we have the number of people dying in British Columbia today on a daily basis, waiting for diagnostic services or surgery, is comparable to the number of people who are dying from the opioid crisis. And nobody's talking about it.
Yeah.
And it's crazy. Yeah. Like I find that completely unacceptable.
Say that again.
The number of people who are dying on a waiting list for diagnostic services and surgery in British Columbia is comparable to the number of people who are dying of overdose deaths in British Columbia because of the opioid crisis.
Right. Well, it seems to me that in Canada right now, and I truly believe this, that there are so many things happening that at a level that's actually scandalous that no one can keep up. I've really watched this with Trudeau because it's something remarkable for me to see. Like about every 2 weeks, the Trudeau government has a scandal of sufficient magnitude under normal circumstances to collapse a competent government, and yet nothing happens. And then the next scandal comes along.
It's because people have lost faith in reporting because there's so much information out there. So actually, one of the things I want to do is change politics forever in British Columbia. And what I want to do is we have what's called freedom of information requests, right? You have all this information, which is public information. And if you want it, you have to pay a certain amount of money, and you can apply to access it. And months later, you might get some redacted document, right, that you get. I'm going to change that. I'm going to get rid of freedom of information requests because I'm going to make all of the information that can be made public.
Like they did in Lithuania.
The job of the freedom of information officer should be to say what can't be made public.
Right.
Give the people the facts. Yeah. Give them the information. And then it's no longer politicians that are giving spin, but politicians that are responding to the facts. And you can judge political parties based on facts as opposed to based on whatever spin they're giving. Try to build some confidence and a little bit, restore some of that confidence back in government and government institutions that's being lost and continually eroded, particularly because of what's going on with the politics of the left.